All right. Well, we should talk about deals. Hey, Jess.
Talk about deals.
Are you bored with the show? Should we do a better show?
You know what? I think we should do a better show. We have a show. Should we do this? Or are we going to do a takeover?
Oh, for it.
We're going to take over.
We're taking over.
We're taking over. Move over.
Should we? I'm going to mute myself. And
No,
you should join in.
All right.
You should
join in to take over your own show.
The best, everybody's favorite 2 minutes of questions and answers about health technology. Oh yes, it is a takeover episode of Health in 2.00, the April 30th edition.
Okay, are you going to hum? Shall I hum it? I have to drop in.
Woo! The ceiling, and then you got to get sucked back up. That's my favorite part of the whole animation. Is when you get sucked back up.
Luckily, he was wearing shorts.
All right.
Luckily, he was wearing
like those shorts. See a
I
little
was wearing.
Woo!
All right, Jess, come on, let's do it.
All right, let's do it. Oh my God, this is our first time doing a digital audience. We've had like a live studio audience at a couple bars before. There was one time somebody passed you a drink at HIMSS. That was pretty funny, but here we are with our first ever digital audience. Set that timer. Let's go.
Oh God,
big deals to discuss.
Oh, I missed it.
It's not going.
No.
Okay, Medici gets 24 million in a Series B round. Telehealth.
Medici, interesting company. I've done a little bit of work with them. Clint Phillips is the CEO, South African guy. He did Second MD before this, Second Opinion platform. And they they're a thing where you as a doctor can it's a thing to take FaceTime, to replace FaceTime and Zoom. It's got all the stuff in it that you as a doctor need to manage your own practice. It's more of a competitor to that than it is to American Well or whomever. Amwell. Sorry.
Startup comes out of stealth mode. Andreessen backed Tomorrow Health for in-home healthcare. Tell me about this one.
Julie Yu is kind of now hanging out at Andreessen Horowitz, A16Z. She likened this to like revolutionizing primary care at home. She's talking a lot about that. It's basically delivery of stuff to the home that you need for at-home care. It's not the rest of it. There are going to be a bunch of people doing the other part of it as well that we can talk about soon.
Okay, some Telemed smurgy deals. IDC Telemed buys Ilum, and SRI funds Decoded to work with Virtuity. What is happening here? It's like another telemedicine. Everybody's becoming a telemed company.
The first one is a merger of like a UPMC service for doing infectious disease control, like a telemedicine thing, with an AI tool, the Ilum Health thing, which Merck backed. They both chucked in more money, and that's going to become like an infectious disease control AI thing for COVID. The other one is SRI, this SRI Decoded, which is like an AI-based telehealth thing, which is going to hopefully line up and provide a telehealth service for Virtuity, which is a big medical group which does like anesthesia and emergency rooms and what have you. So what's happening here is that kind of like the AI tracking of who's going to get sick and the telehealth bit and the services of the doctors are all coming together. You're going to see a lot more of this stuff as we have to figure out how to live a care when we don't know anything.
HIMSS launches a digital health indicator.
Oh, we just got there.
She squeezed it in.
I've been dying to talk about
but
this.
This is the reason you want to talk about this is because this is why you're doing it here. Go on.
This is the new MRAM. HIMSS has invented a new survey to administer to hospitals to judge their digital health readiness. They are selling this thing. This is how they're going to offset that lost conference revenue.
Well, I will tell you about the official part. Then Eugene can tell me how impressed he is with this. We should go for it. So MRAM,
I was going to say how many hospitals will survive though?
EMR adoption module, right? HIMSS made some money selling the idea that you could say you were a stage 5, stage 6, stage 7. This was incredibly popular in
other countries,
the Emirates and God knows where else, but a little bit
in Europe. We saw that in Europe.
Australia, so popular down there.
But really, you guys should. Jess, how impressed are you with HIMSS's new definition of digital health? Because they're certifying that you've met their definition.
Okay, so HIMSS's definition of digital health is just like a bunch of words that basically ends with like any service, any digital service or tool that helps you deliver care. So I kind of think that like me with the right kind of spreadsheet might qualify as a digital health company according to the HIMSS definition.
Jess, you were looking up your garlic producing and how it grows and the impacts it has. That's digital health.
I mean, right there, according to HIMSS, level two on the digital health indicator.
So what happens to the word digital health now where everything's
oh my God, don't get me started because I have a whole rant about this because truly these words are meaningless. Like you can look at like, I mean, so HIMSS launched out a definition. The Digital Therapeutics Alliance has a definition, and to define digital health, they've got to define within it digital medicine, and then within that digital therapeutics. And it's like based on the level of, you know, clinical validation that's happening, like so things can get reimbursed better. Then the World Health Organization, I think it was last week, they issued their digital health guidelines and they've defined digital health. But wait for this. They have to go all the way back to e-health. And then they define health, and then they define digital health. I'm like, oh my God, like these words are just meaningless.
But again, the visionary in my bottom right below me, has defined smack health, right?
That's the best one.
The definition.
That's because the collective noun for a group of jellyfish is a smack.
Exactly. Look, we learned that. ATA, I think we learned that.
It's all about, come on, it's all about trying to extract more. That's the sad thing here, is that when you've got software which should make stuff scalable and cheaper, the people doing digital therapeutics are trying to extract more money out of it. If you look at when something was available as a consumer thing, it was like $100, you know, or $20 a month or something, and now we can make it a digital therapeutic, and it's now thousands of dollars a month. They're trying to get on the same path.
So hold on a second. I'm going to dig in on that. Who's charging thousands a month? Because I still think there's no real model that's been defined on pricing. Like I'm actually curious, like Silver Cloud Health, like you know, what are they charging?
I agree. I don't know. We should ask James. All the Irish guys stick together and share pricing. But if you looked at a key, Brian Dolan in his E&O newsletter had a bunch of pricing. I think it was a Keeley, and like before and after it was like 80. I mean, it was $80 a month, and now after it was like $900. I mean, it was like a factor of 10 for the same thing, or maybe it was Big Health. I can't remember. It was one of those digital therapeutics companies. I don't know. It strikes me that it's that the buyers should be saying, you know,
pricing. I feel like pricing's all over the map right now. Like pricing, like we see all kinds of digital health companies giving their stuff out for free right now with COVID-19. Oh, sorry. And like,
you said it. You're not pay up. Yep. There we go.
So we see all kinds of free stuff going out right now, which makes me a bit nervous. Like a lot of the governments are getting people to kind of respond in their, you know, contribution to society, but these companies aren't profitable. And then we see anywhere where the doctor is still involved in the appointment, it's full fees. You know, so we've seen lots of markets with full fees. And you know, I think like Silver Cloud's been around forever. They've kind of cracked a business model. Like can't speak to the specific, you know, pricing model, but they've got something working. It's a per member per month.
But in the end, right? Less so in Europe and Asia, but certainly in the US, what this whole thing is exposed is that the way we pay the healthcare is totally stupid, right? Now you're saying, well, hospitals at the time we need them the most are all going, their revenues collapse by 40, 50% because they're not able to do the stuff that they make money on.
They make money on, right?
Most uses, like all that elective surgery, most of which is overuse. And primary care those folks are all going bankrupt because they were only making money by seeing people in their office. When we know we have the tools to do primary care at home or, you know, remote monitoring or surveillance or whatever. So hopefully after this, there'll be a proper discussion about how do we change the payment model totally. Whether it'll happen or not, I don't know, but that'll be my hope.
Right. So the one thing I took out today, and remember I'm the timekeeper. We're trying to keep this below 30 minutes based on your suggestion, Matthew. So the one thing I took
drinking as well, drinking.
That the jury is still out if HIMSS is going to be able to make money on MRAM because who knows how many hospitals will survive. And two is that it's possible to do a show within a show. So that was pretty awesome.
I just interviewed you in the middle of that Health in 2.0. all right, if I did a WTF Health interview, in the middle of that Health in 2.0, in the middle of a shot of digital health therapy, we would have had the, what did you call it, Eugene? The turducken of digital health shows. It would have been like a it would have been a bomb that just kept exploding.
Like a vortex.
Vortex. How many made-up shows can we
Black hole.
The last thing I'll say, Jess, I love that sweatshirt, WTF Health. And I'm sure Marina would love it too. So hint, hint.
Thank you. Thanks. A little blingy. Got to represent.
It is.
All right.
Listen, another unproduced. This was awesome. Thank you, people.
Thank you.
I'm looking forward to the next
Jessica,
one.
thanks for taking over. You've made the lifting
You've
easier.
hijacked your show. We'll give it back now.